Just this week, federal health officials called for tougher warning labels on pain relievers like aspirin, acetaminophen, and ibuprofen. They're safe when used properly, but the concern is Americans may not be aware of potential side effects or the potential for overdosing, and that can cause some unexpected health problems. Millions of people take anti-inflammatories to ease some ache or pain, and doctors say that's fine.
If you have to take it once in a while, there's no problem.
But there is a problem, says joint specialist Dr. Peter Fields, if once in a while turns into all the time, where patients in essence overdose on anti-inflammatories.
Naproxen, Advil, ibuprofen, all the anti-inflammatories. The trouble is that people get into a chronic cycle, and usually they need more and they need more.
Dr. Fields says that's because a certain amount of inflammation is not only normal, but necessary. It's often our body's way of protecting itself and allowing healing to take place.
Anti-inflammatories medicines by themselves will do damage. People can get bleeding ulcers. People can suppress the actual healing properties that take place within a joint and a ligament.
In fact,
chronic use of anti-inflammatories can lead to destruction of a joint.
Something else many people may not be aware of is the effect anti-inflammatories can have on blood pressure.
Anti-inflammatories actually can raise blood pressure too, so that people who are on blood pressure medicine who take excessive amounts of anti-inflammatories, which happens especially in older crowd, can actually be raising their blood pressure slightly.
As for those popular cortisone steroid injections,
in weight-bearing joint, no, you should not have more than 3 because of the, as I said, the sometimes destructive effect it can have on the joint itself.
Dr. Fields says if you've been taking anti-inflammatories for too long, then it's time to seek out a different treatment. In other words, focus on fixing the problem instead of just masking it. Finding the right treatment varies from injury to injury and patient to patient, but the key again, fixing the initial problem.